Let's bring in your good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, for his weekly visit with us. And Joe, where do you want to start this week, my friend?
Hey, Ray. Good to see some sunshine this morning, and
Yes.
a little taste of spring this week. It's really good. But I wanted to talk a little about, when we get in the sports medicine world, sometimes injuries run in cycles, and you know that sometimes teams can be affected at all levels, so high school, college, professional. Sometimes position groups get particularly injured, and guess what position group in Cleveland sports is really taking a hit right now is Cleveland Cavalier guards. We really don't have a true NBA guard on the team right now, so this good winter story of the team doing so well is kind of hitting the wall a little bit here in the last week or two. So injuries to Colin Sexton out for the year, Ricky Rubio, Darius Garland, Karis LeVert. Geez, we hardly knew you. He's now hurt and out of the lineup. And Rajon Rondo. And I was just going to touch on an injury to Rajon Rondo that we do see a bit. We haven't talked about it for a while. Is when he was injured the next day, we read that he had an MRI on his foot, and he had a sprain to his great toe, and he was going to be out for perhaps 3 to 5 weeks with a great toe sprain. And so I was going to talk a little about toe injuries, great toe injuries. They're pretty common in sports. They happen a lot in high school kids. We see them in our clinic quite a bit. It's not an uncommon injury. There's a slight bit of a difference. It's really splitting hairs between a toe sprain, great toe sprain, and a turf toe. You hear a lot talk about turf toe and toe sprain. Turf toe is an injury that occurs when people hyperextend the toe, and they're pushing off. They overextend the toe. They might have one injury where they feel a pop, but they continue to play through it, and they stretch the soft tissues, the tendon and the ligaments, and then every time they push off, it causes a lot of pain and weakness, and they can't push off because they have torn or stretched the ligaments and tendons in the toe. They did not mention turf toe in the articles I read about Rajon Rondo. The other type of injury is there's ligaments on the side of the toe. They're called collateral ligaments, just like in the knee. And what happens to athletes is they twist the foot in an awkward twisting motion, and they can tear the ligaments on the sides of the toe, and that's just really known as a toe sprain, or the collateral ligaments, or a toe sprain. It occurs more with twisting injuries. So hyperextension versus twisting is partly we diagnose these partly by the history they give us when they come in. But the exam is really, really helpful, Ray. So the first we get their hands on their foot, we examine always like other joints. We look at both feet, and you look to see, is the great toe swollen? Where is it swollen? Is it stable? Can we pull that toe back and hyperextend it too far, much further than you can on the other foot with swelling and bruising? Then it's probably a case of turf toe. Versus if you can move it from side to side too much more so than the other foot, it is probably a collateral ligament injury. And the words we use in medicine, we use code words all the time, is stable or unstable. And if it's very unstable or loose, we have to start into some treatment. And that must be the case with what they're doing with Rajon Rondo. Now, in our clinic, when we see them in, we may well x-ray them. Much of the time, though, it's not a bony injury. If it is, it can be an injury to the bones of the great toe or those two bones underneath the big toe known as the sesamoids. We talked about those before here. People get stress fractures in those bones a lot. But much of the time, it's soft tissue and it's a sprain. And to really diagnose a sprain, you need an MRI. Well, guess what? All of my athletes are not in the MRI, in the NBA, and we don't rush off to MRIs on these toe injuries. Much of the time, we start them on treatment with taping or orthotics or a stiff insert that we put in their shoe for the grade 1s and mild grade 2s where they just stretched or maybe mild tears. But for the grade 3s and 4s, we often have to put them in a boot, and they're going to be about 3 to 6 weeks for those ligaments to tighten up and heal, just like they do in the knee with an MCL or the ankle with a bad ankle sprain. And so we wait for them to heal. For kids that really care, we get them into some PT to reduce the swelling, improve the range of motion. And there's a lot of strength in little muscles in the foot called intrinsics they have to get back. Remember, though, Ray, if we're dealing with middle-aged to adult people, if they have redness and swelling and they don't tell us about any injury they had, this is a big joint for gout, too. So we have to think in adults about gout, but not in my patients in the high school setting. They tell us the history of twisting or hyperextending the foot. And in really bad cases where they play through it and play through it and play through it, they've stretched it out and there's just not a lot of good healing. We do sometimes go to an MRI and even talk about surgery for these people. But the younger they are, the better chance they're going to have to heal. They just don't wear, the prevention would be more supportive shoes, but athletes don't want to wear the heavy shoes anymore. Hey, where have all the high tops gone, Ray, that when we played, there used to be people in these, heavier shoes and high tops with more support. Kids, the athletes don't want to wear those shoes. They want speed. Everything's about speed. So you don't see those real supportive shoes. And that's why these injuries have increased at all levels, the high school, the college, and the professional level. So today's question is a layup for a guy like you who knows everything about sports. But what NFL Hall of Famer had turf toe end his career in the 70s and 80s? I know you know this one, Ray.
Jack Lambert.
Yep, Jack Lambert had a real bad toe injury. But do you know in the last 4 years of the NBA, a couple of players that are pretty good, A.J. Green, Devontae Adams, Patrick Mahomes, Tom Brady, have all had cases of turf toe or bad turf or toe sprains. So they occur to even the best of athletes. They occur at all levels. And I wanted to touch on a little today. There's a slight difference between the sprain of the ligaments on the side and the turf toe injury. And I wanted to remind kids that if you get into a more supportive shoe or an insert in your shoe, sometimes a stiff insert will help protect that toe from turf toe, especially if we catch it early on. If we catch it late, it may be hard to get it to heal, and they might wind up, albeit rare in my population of high school kids, needing surgery to fix that toe. So it's a common injury, and I wanted to get a chance to touch on it today. And, gosh, let's get some Cav guards back out on the court and see if they can't make a little run here at the end of the year and stay in the playoffs.
Joe, that turf toe also ended the career of NFL Hall of Famer Deion Sanders. Also ended his career.
Yes, it did. You might have mentioned that to me before. You don't even answer the question, only the question I ask you. You even go further and get extra credit. Were you one of those kids in school that got the 110 on the exams instead of the 100?
Don't I wish, my friend? Don't I wish? Joe, great visit, my friend. Thank you again for the quiz and the education. We'll catch up with you next week.
Have a great week, okay?
You too, my friend. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center with us.